Vihi sa anuvasanaihi. The anuvasana basti along with the sarpi, or the basti along with the sarpi or the taila can be given, or snigdha ushnair annapanescha, or the intake of food also like snigdha and ushna annapana should be given whenever there is a vata pradhana. Then विरेचनेन पयसा सर्पिषा संस्कृतेन च विषमं तिक्तशीतैश्च ज्वरं पित्तोत्तरं जयेत्. So whenever you feel like it is a pitta aggravation is there in case of vishama jwara, then you have to go for the paya pana, isn't it? Payasah sarpishah samskritena cha. Samskrita means here it should be the paya will be adding samskara with the appropriate drugs. Vishamam tikta sheetaischa. That's why the samskara with the tikta sheeta drugs along with the payas can be given to the patient in case of pittotaram. Okay. And vamanam, pachanam, ruksham, annapanam, vilangitam, kashayoshnam cha vishame jware, shastam, kafotare. So the vamana and pachana kashaya can be given. Pachana, ruksha, annapana and lankana can be given in case of jwara. That means in case of vishama jwara, predominance with kapha, wherein if the bahudosha avastha is there, you are going for vamana or you are going for pachana, ruksha, annapana and langhana. Okay. And kashayoshnam cha vishame jware, shastam kafotare, and kashaya, the different types of kafahara kashaya can be given to the patient in case of kapha predominance. And in case of vishama jwara, we know that vishama jwara, like the present COVID scenario also we have seen, when the jwara the comes, because it in many of the patient it will be, it's the signs and symptoms or the chronicity will be different from different persons, right? So accordingly, when the patient is continuously having fever for many days, some 10 days, 15 days, etc., no, so definitely they will think, so this is maybe because of some other reason. Maybe it is the shapa or abhichara, or it may be something like a deva kopa, etc., like, isn't it? So what they will do, they will definitely go for some of the other line of treatments like the deva vyapashraya chikitsa. Of course, this is also very very important. Why it is important means, even because of the continuous fever, the patient mentally also will be very much disturbed. Physically, of course, he'll become already weak. So what happens, he himself will be thinking, or even the family members also will be having the the different kind of opinion that something might have happened, it is not a normal fever. So what happens now, so they will be thinking in different angle, isn't it? In such conditions, definitely they will go for the the help of God, isn't it? So that is always important. That will give the patient a very good moral support. Okay, so that is why it is more important. Somam sa anucharam devam sa matra ganam ishwaram ujayan prayatah shigram uchyate vishamam jwaram. Now definitely the patient as well as the patient's family will go to the in a different angle. They will think and they will go for different puja, homa, isn't it, havana, or even chanting of different types of mantras, or even wearing of money, isn't it? Everything will be there. Vishnum sahasra murdhanam chara charapatim vibhun stuvan nama sahasrena jwaran sarvan apohati. So especially the Vishnu Sahasranama has been mentioned, and of course there are so many research work is also going on by, even I think even during COVID period also people have tried differently, like chanting Vishnu Sahasranama in particular group, and without that the common medications has been given. They have seen some good improvement in this particular group of people, those who have chanted with the it may not be directly a Vishnu Sahasranama, it may be according to one's own the belief, isn't it? If the people are of different religion, accordingly they can chant the mantra or whatever the reading they wanted to read, isn't it? So that means what, it will have a different action on our mind, isn't it? That means the mind will be the tensions will be relieved, as well as the mind will be activated, or even they will get a very fantastic moral support with this. Of course, everybody, almost 90% of the people will believe in God, right? So something, when they do such type of rituals, the body healing capacity will be improved. That is what indirectly how this Devi Vipashriya Chikitsa will be helping in the people. Okay. So indirectly, the body is healing. Of course, every individual will be having this healing property in our body, because very rarely we will be reading, or sometimes we will be having this, the different kind of very chronic diseases like cancer, etc., healed in some people, like, isn't it? So that means what? The body's healing mechanism. That is the very, very, the important thing. So without body's support, or the healing mechanism, no, whatever the medications you give with the negative impact, it will not be helpful. So this particular Vishnu Sahasranama or any other rituals will be helpful in relieving the jwara. Okay, so Brahmana Ashwinam Indram Hutabaksham Himachalam Gangam Marudganam Cheshyam Puja Pujayan Jayati Jwaran. So you have to go for the elders, the gods, etc. And even Bhaktya Matuhu Pituraischa Gurunam Pujanenacha. So one should always think. Sometimes what will happen, it will be like a kakataliya, we tell, like, no, somebody will be getting fever at the same time, something might have happened at the home, or it may be because of the Shokaja Jwara also, isn't it? In such conditions, what happens? They will realize that I have done some mistake. So now I have to confess, or I may have to give more importance to the puja gurus, or the our Matra Pitra, etc. So such a thing is also very, very important. That means all these things together, what we have to understand is every life, or even a human or an individual, should always follow the rules and regulations, or the codes and conducts which has been mentioned in the Swasthavrata, isn't it? The Dinacharya Adhyaya or the Rutucharya Adhyaya, whatever the Sadvrata they have mentioned, that is very, very important, isn't it? That means whenever we deviate from such things, maybe it is the spiritual, or it may be the what you can call the codes and conducts, what we are supposed to practice. If we are deviating from that, so all these things will be a cause for the different ailments in our body, right? So that's why he's telling Brahmacharyena tapasa satyena niyamena cha japa homa pradhanena vedanam shravanena cha jarad vimuchyate shigram sadhunam darshanena cha. Isn't it? So all these things are very good, but it should be limited, and accordingly, scientifically, we have to do. In the mean, scientifically means we should have the belief. Okay, so at least if you don't have a belief in other things, at least you should have to follow the right, the course and conducts of our life, isn't it? So we should not deviate from the satya, niyama, etc. That is the importance of Daiva Vyapashraya Chikitsa, how it helpful in different vyadis as well as in Vishamajwara. Okay. So next is telling some of the Jwarahara Kashayas. There are so many Kashayas. Preparations has been mentioned in the chapter, but I have not gone to the details of that. Only few I have mentioned here. That is Vatsaka Aragvada Patha, Shadgrantyam Katurohina Murva, Ativisha Nimba Patolam Danyaka. So all these things you can just read from the. So whatever the important thing, according to the condition, you can select some of the preparations here and use it. And we have seen the Vamana in Jwara, Virechana in Jwara, isn't it? So we know what is the indication, contraindication, benefits of these things, and which avastha we have to practice this Vamana and Virechana. But while practicing, what are the different medications we have to use? That is also very important. That is what now we are going to see, the different medications for Jwara. Okay. The Vamana in Jwara. So he's telling here, Jwaribhyo bahudoshebhyaha urdam cha adascha buddhiman dadya samshodhanam kale kalpe yadu pradekshate. So in Jwara condition, especially maybe we have seen the Vamana in the Taruna Jwara itself, isn't it? Whereas Virechana in the end, like in the Jirna Jwara. So that means that's why he's telling Jwaribhyo bahudoshebhyaha urdam cha adascha buddhiman Dadya Samshodhanam Kale Kalpe Yadupakshate. By considering the Kala, by considering the avastha of the patient, by considering the condition, whether it is in the initial stage or in the Jirana Jwara or in the last chronic stage, according to the buddhi of according to the yukti of the Vaidya, one should administer this particular Urdhva or Adho Shodhana appropriately, which has been already mentioned in the Kalpasthana is mentioning here. So only few examples he will be mentioning, like Madanam Pippali Virva कलिंगैर मधुकेन वा युक्तम् उष्णाम्बुना पेयं वमनं ज्वरशान्त्ये क्षौत्राम्बुना रसेन इक्षोर् अथवा लवणाम्बुना ज्वरे प्रत्यर्दनं शस्तं मध्यैर्वा तर्पणेन वा. Okay, so here he is telling either simple madanaphala along with pippali, kalinga, maduka, etc., or yukta mushnambuna yukta. So or even the pamana performed by hot water and madana mixed with either pippali, kalinga, maduka also. Okay, or even the therapy which will be administering here he is telling kshaudhrambuna rasena ikshor athava lavanambuna. Because one thing we have to understand, the vamana or virechana what we are giving, we are the specific thing what we have to always we have to keep in mind is we are not going to do the purva karma here like the snehapana etc. Okay, for vamana as well as virechana, that is we are doing the sadhyo vamana or sadhyo virechana. That is why it is akanta paryanta pana of the shaudrambu, or it may be an ikshurasa, or it may be a lavanambu. Okay, or it may be a ushna jala definitely, or it may be a payas, or it may be madana, pippali, kalinga, maduka, etc., the kashaya which has been prepared out of it. So these preparations, these different kinds, so the depending upon the satmya of the patient, or the the different especially here the kapha dosha is predominant, right? Or according to the availability of the drug, or according to the immediate or the instant action what we want at that time, what is available, you can take these things. So whenever they ask question like the Tarunajwara Chikitsa, no, you will be writing Langanam, Svedanam, Kalu. So Langana, you have to write either Vamana or Langana according to the condition. When you write Vamana there, then you need to mention few the drugs name like Madana, Pippali, Kalingaka, etc., or like Ushna Ambu or Ushna Labanambu or Ikshurasa or Kshaudrambu, like that. Okay, so that is why it is important here, because when you write only these two lines shloka like Laganam, Svedanam, Kalo, you may not get marks. Okay, or it is not only for the marks or even to practice also. So Langana means what you have to do. Vamana means what are the different types of drugs you can use when you are, it is a jwara case. Okay, so similarly he is telling jware prachardanam shastam madhyerva tarpanenava. So it should be, so after even the alcoholic drinks or even the tarpana is also useful in jwara. He is telling jware prachardanam shastam madhyerva tarpanenava. That means after having this particular elimination of the doshas, prachardana means it is the vamana only. Okay, so prachardana always for the, there are two different words. One is prachardana, another one is praskandana. Okay, both starts from prachardana, praskandana. Prachardana means it is vamana. Praskandana means it is virechana. So jware prachardanam shastam madhyerva tarpanenava. So after that you can give with the tarpana or the alcoholic drinks according to the satmya of the patient. Okay, so hope it is understood for you people. That is madana, whenever it is vamana you are giving madana, pippali, kalinga, maduka, either in combination or differently you can give, or ushnambu or the peya or shaudrambu or ikshurasa or even lavanambu akanta paryanta pana will be given to the patient so that the vamana will happen. Next is telling the praskandana, that is for the virechana purpose. What are the different type of drugs you are using? Mradvika amalakanamba. So Mradvika amalakanamba rasam praskandanam pipit. Mradvika is the draksha, right? So draksha whenever you give in a more quantity, or the draksha kashaya when you prepare and give to the patient, it will be like act as a anulomana. Or amalakanam, or along with that amalaka can be given, or rasanam amalakanam va grita brishtam. So amalaka can be do the grita brishta, then you have to prepare the rasa out of it and give to the patient. And then lihyadva traivatam churnam sayuktam madhu sarpisha. So directly trivrat churna along with the madhu and sarpi can be given to the patient. Pibedva kshaudra mavapya sagritam trifala rasam. So kshaudra along with the trifala grita can be given to the patient. Then aragvadam va payasam radvikanam rasenava. Aragvada kalamajja, as you know, it is a sramsana, isn't it? It's not a purgative here. Or even payasam radvikanam rasenava, or directly, as we know already, payas can be given in more quantity, that will act as a virechana, or it can be given along with mradvika or the Pradvikarasa separately also can be given. Trivrutam trayamanam va payasa jvaritaha pibet. Jarad vimuchate pitva mradvika abhisa abhayat. Mradvika along with abhaya jala also can be given to the patient. Payo anupana mushnam va pitva draksha rasam naraha. Whenever you give these things, anupana can be given as a ushna jala. Okay. So these are the different drugs. When you mention Virechana in Jwara, you have to write Virechana with any of these things according to the availability, according to the Satmita of the patient. Okay. Then he is telling how the different types of milk preparations can be made, or along with we have seen the paya pana or niruha basti with the paya, isn't it? So what are the uh, different drugs you can boil with the milk, which is also jarahara in nature, or which is specific doshahara in nature. So he's telling here kasa shwasa shirashula parshashula parshashula shirajura Chirajwarat. Chirajwarat means Jirna Jwarat. Muchyate Jwaritaha Pitva Panchamoli Shrutam Payaha. So the Panchamula Shruta Payaha will be helpful in relieving Kasa, Shwasa, Shirashula, Parshashula in case of Jirna Jwara. Okay. And Eranda Mula Mulotkwatitam Jwarat Sa Parikartikat. Okay. So whenever there is a patient with Baddha Varscha along with the Parikarta means the anal region, they are having a lot of pain. Because of the constipation. In such cases, he is telling Eranda Mula along Eranda Mulot Kvatitam. So the Paya along with Eranda Mula Kashaya. And then Payo Vimunchate Pitva Tadvat Bilva Shalatu Bihi. Along with the Bilva Shalatu or the Bilva Phalamanja, you can use the Paya can be boiled and given. And then Trikantaka Bala Vyagri Guda Nagara Saditam Varcho Mutra Vibadhangunam Shofa Jwaraharam Payaha. So it is what happens here. All these things will be helpful in alleviating the Baddha Varsha Baddha Mutra, isn't it? So that means it will be helpful in relieving the Vibandha as well as the Shofa Jwaraharam Payaha. It is Shofahara because we know that Panchamula or Dashamulas are always it is Vata Kafahara Shofahara in nature, right? So it will as a Shofahara, Jwarahara. So this is the different formulations of the medicated milk. Okay. And continuing with that, he is telling Sa Nagaram, Sa Mradvikam, Sa Gratak Shaudra Sharkaram, Shrutam Payaha, Sa Karjuram, Pipasa, Jwara Shantaram. In different conditions, the milk can be boiled with the different kinds of drugs here, like Karjura, Nagara, Mradvika, etc. So along with that, Krita and Shaudra Sharkara can be added. And Chaturgudena Ambasava Shrutam Jwaraharam Payam. If nothing is available, even just the milk can be boiled 4 times and then it can give to the patient. Definitely it will become Jwarahara and which will improve the Agni also. And Daroshnam va Payaha Sadhyo Vata Pitta Jwaram Jayet. So Daroshna Paya means immediately after milking. Directly it can give to the patient. Sadhyo Vata Pitta Jwaram Jayet. So it will be immediately, instantly it will be helpful in relieving the Vata Pitta type of Jwara. Jirna Jwaranam Sarvesham Payaha Prashamanam Param. So in case of Jirna Jwara, always milk will be the very best. So similarly, how Sarpi is best in case of Jirna Jwara. Similarly, in order to relieve the Prachuta or the Baddha dosha or the Prachuta doshas from the body, to relieve or to eliminate this particular, the medicated milk will be helpful. Peyam tadushnam sheetam va yatasvam beshajaihi shrutam. The peya which is Ushna Shita will be yatasvam beshajaihi shrutam. Along with the Beshaja, different kinds of Beshaja, it will act as either Ushna or Shita and it will helpful in relieving the different kinds of dosha. Okay, so next is Basti and Jwara. I think we can stop here and continue with the next class. Is it okay? It is already 9. Are you there? Anybody? Hello? Hello?
Hello.
Yeah, I think we can stop here.
Okay, doctor.